So I also heard that worldwide sperm quality has been declining over the years, and that these minimum thresholds have also been lowered.
Yes.
Is this true, and or is it just
No, it's true. Definitely.
Okay.
See, now first and second guidelines, they said that 60 millions was the minimum count, and then 40 millions. Now, why it has come to 16 millions is because of rapidly declining counts all over the world. And there are so many reasons for that. So, to discuss reasons, I think it's a different topic. But the major reason for this is microplastics. So, last one decade, we have been depending on plastic for everything. And plastic is like we call plastic as male endocrine disruptor.
Okay.
So, knowingly or unknowingly, we are depending on plastic for everything. For water, food, food transportation, for cooking, heating. So, we have been using plastic for last 10 years. So, now what plastic does is, there is a chemical called bisphenol in plastic. This bisphenol, whenever this plastic is exposed to heat, so then this bisphenol is released into that food part.
Okay.
It enters our body, it affects hormonal center. So that is why it's called male endocrine disruptor. And basically what it does is, it converts testosterone into estradiol, and testosterone production goes down, which is a male hormone is going down, and female hormone, which is estradiol, is on the rise.
Okay.
So now when there is this imbalance between these two hormones, and it affects all the systems in the body, and mainly first thing it affects is fertility. So it affects spermatogenesis. So spermatogenesis, when it is affected, not only, this is not for one generation. Once it enters into our system, it can go on for 3 generations.
Okay.
So that is the reason our fertility, our counts have gone down. And even the next generation kids, what we are seeing now, who are in around 5 to 15 years age group, why they have so many other issues is because of this hormonal problem.
Even before puberty, they're starting to have some
because there is hormonal imbalance by birth. And normally what we think about plastic is, normally when you want water, you go to a shop, you get water bottle, you drink it. But what is happening at manufacturing level, they're actually filtering the water, they're actually putting in the bottle, and transportation. Most of these issues, exposure to heat, is happening in transportation, whether it is water bottle or cooling bottle. Now you might have seen how it is getting transported.
Correct.
Most of the times it is transported in trucks.
Correct.
So now trucks, they travel hundreds of kilometers in sunlight before they reach
the destination. The shop.
So by the time the damage has happened. So now all our water bottles, cool drink bottles, at some point they're exposed to sunlight or heat. So they're all polluted. Second thing, we used to get curries and food from hotels. Even now, if you check Swiggy and Zomato, whenever you order something, they are still packing them in plastic plastic containers. So again, those are already exposed to it. By the time they reach you, the food is exposed to bisphenol. So these are all silent killers. So we may not understand the impact of this, but that is what we are seeing in reality in fertility, is same thing. What should have done 10 years ago, still now it is continuing.
So a lot of people don't believe the impact that this is having on their body. So is this studied? Are there enough tests done? Research labs?
Hundreds of tests. See, now the concept of BPA has come into picture only because of this. Now, if you see the milk bottles, baby feeding bottles, what were there before? So before this BPA era, we used to use normal plastic bottles.
Correct.
We used to reheat them, we used to boil them.
Correct.
And we used to feed babies with the same bottles.
Yeah.
So babies were fed with bisphenol. So now then government understood that. And then this BPA bisphenol free containers have come into picture now.